Alright, so as I said, today we're going to start off by finishing off the slides on social development during adolescence. So remember that we don't necessarily have a hard and fast time period for adolescence, somewhere starting around puberty and ending when we move into early adulthood, which, as we're going to talk about in a second, is very difficult to define as well. Now, last time we were talking about social development in adolescence, we primarily talked about relationships. So we talked about dating, we talked about sexual activity. Today we're going to be picking up talking about career development. Now, certainly during adolescence, you wouldn't think of an individual as having a career at the moment, typically, although it is during adolescence perhaps that we start to wonder what our future might look like, what kinds of careers might be interesting to us. So, during this early part of adolescence, maybe 13 to 14 years, usually teenagers start thinking about what kinds of careers they might want, what kinds of careers might go well with their particular talents and interests, although the future is still pretty open at this point. But then as they get older, they're going to be asked to make choices that are going to limit or narrow or specialize their field, their options. There are several different ways we do this. One thing might be the types of classes that you choose to take in high school. If you have choices about taking kind of college prep classes versus more like vocational classes, that kind of thing. But then certainly if you go to college, then you have to think about where are you going to go. You're going to go to a 4-year university, 2-year community college. What are you going to major in? So you're making a lot of really important decisions there. And then once you get some training in a particular field, then you're going to implement that by actually going into the workforce, getting a job, learning how to have a career. So one thing to be thinking about during adolescence is what type of personality do you have and how could you best match that to a job? And so this is something that a high school counselor might help students take a look at. Certainly there are plenty of quizzes and things you can take to try to match you up with a career based on your personality. Now, one thing I will say is that your personality is still developing. We would never diagnose someone with a personality disorder until they're at least 18 years old. And so essentially what we're saying there is that your personality is not going to be fully developed until then, at least. The frontal lobe of your brain, which certainly has a large impact on your personality, is not fully developed until around age 25. And usually you're having to make decisions about at least what you want your major to be long before then. But it is a good idea to have at least some ideas about careers that might match your personality, because there are some careers that are better matches for some people. For example, not all of you, but many of you may be psychology majors. There are certain types of personalities that would do really well as a psychology major, but then I'm sure you know people who would make terrible counselors. Not that everyone who is a psychology major will go on to be a counselor, but certainly some people just are not cut out to listen and empathize and understand and to be helpful and supportive. So there is a theory here that there are at least six personality prototypes. And you have these listed here. I'm going to go ahead and go to the next slide so you can see some detail about each one of these. The idea is that your personality will probably fit into one or more of these. You may be a combination of a few of these, but basically there are some careers that are associated with certain types of personality. So some people might have a very realistic, very practical type of personality, and so they might enjoy things that involve concrete problems. So working with your hands, something that has a definite concrete solution. So it gives some examples of vocations similar to that, mechanic, that kind of thing. Investigative, so people who enjoy doing research perhaps, people who enjoy thinking about abstract concepts. So once again, not concrete, but we're abstract here. Task-oriented, so this could be things like scientists or other careers where you're actually investigating something. Social, this would be if you're planning on being a psychologist, likely you have a large social component to your personality where you are skilled in relationships, enjoy solving problems among people. Certainly this could be great for counselor, but it also talks about social workers or teachers. Certainly social skills can be helpful in a variety of fields. Conventional, this would be for those kind of classic careers that you think about someone maybe doing accounting, bankroll, that kind of thing. What we're going to see is that these are individuals who have verbal and quantitative skills, so have some like logical, mathematical skills, verbal skills as well, and have some very specific, well-defined tasks that they enjoy doing, not something that is abstract, but usually something that's fairly structured, hands-on. Enterprising, so we see people here who enjoy being in positions of power and leadership. Not everyone enjoys being the person in charge, but some people have that type of personality. Of course, we could make the argument that sometimes people have this type of personality excessively, or someone who insists on always being in power and they're too much power, and that would be another class and another conversation. But certainly we need people who are called to leadership here. So give some examples about business executives, the CEO, that kind of thing. And then artistic, so these are individuals who enjoy expressing themselves, probably have some visual skills, or maybe some, it talks about being a musician here as well, so they probably have some intelligence in this area, some talent in this area, and enjoy expressing themselves through unstructured tasks. So probably when you're in high school, you don't have a firm grasp on your personality, but maybe you're starting to understand a little bit about who you are and what kinds of jobs you might be interested in. So then you might have an opportunity to take part in a job, kind of a part-time gig. One thing you want to think about is that there are certainly lots of advantages to working during adolescence, especially if you limit the amount of time you spend working. You can learn how to manage money. You can learn how to work underneath someone, how to take orders, that kind of thing. But the problem here is that if you start spending too much time on your job while you're still in high school, then certainly that's going to put a lot of stress and pressure. So you can see that as adolescents start working 15 or so hours a week, this leads to lower grades, and that can then cause issues in college later. And then as you get even above 15 to 20 hours a week, this can contribute to a lot of unpleasant behaviors, a lot of psychological issues as well. So it is perhaps a good idea to get some hands-on training, but you might think about doing this in a way that wouldn't interfere with school. So maybe working during a summer break or working over holidays, that kind of thing. One thing that we think about with teenagers working is that they have a paycheck that they earn, and that sounds like a good thing because then kids can learn how to manage money. But one thing that we see is that teens often don't know how to manage money and are usually not given a lot of strict rules by their parents about how to manage that money. And so this could be a problem if kids are earning money and spending money, maybe spending money on things they don't need, then perhaps they're not learning how to be responsible financially later. And so certainly there are lots of skills that schools are teaching and parents are teaching, but I think finances is something that is usually overlooked, and it's unfortunate. We need more information about how to be financially responsible. So other things to think about during social development and adolescence: substance use, with alcohol being one that is commonly used. So it talks here about some statistics. Keep in mind that we get this information by asking teenagers on a survey. And certainly teenagers who are taking these surveys may not be honest because they may be worried about legal ramifications, or what if my parent finds out that I put this down in a survey. So may not be telling the truth, but on a survey, 2/3, so about 66% of teenagers say they drink, and 50% would say they drink enough to be intoxicated, or at least they have done that in the past. Now, when we're thinking about teen drinking, oftentimes this is a peer pressure issue, and so I've asked you to be thinking about peer pressure in the past, thinking about that now as well, but then also sometimes this is happening as a coping mechanism, so because of stress or because of social problems or whatever the case may be. So it can be really effective to teach adolescents how to handle stress, how to cope with social issues, so that they don't feel like they have to turn to a substance for that. And so it talks about in-school, student-led discussions. Certainly there is a right way and a wrong way to do this, and I think the criticism of these programs is that it's often something that is very by the book, and we just want to check it off to say we did it, so then we can't be sued later if someone is in an accident or that kind of thing. It is important to provide good information for kids, not just scare tactics, but good information, and giving them some coping skills so they have something else to turn to. Smoking is something else that could come up during adolescence, and the thing about smoking, as well as alcohol, but especially with nicotine, is that it is so addictive that someone might think that they're just going to do it for a short time during adolescence because everyone else is smoking, and might end up picking up a lifelong habit here. So certainly something to be thinking about. Now, as we're talking about issues in adolescence, as far as mental health goes, depression is something that is very rare in children, but that starts happening usually around adolescence. Not that it can't happen in children, it can, but usually depression starts happening around the adolescent time. At least it doesn't usually happen before then. So thinking about what depression looks like, with depression, there are one of two criteria that have to be met. You either have to have that feelings of sadness or a loss of pleasure, which is called anhedonia, so you're not enjoying things anymore. And you have a combination of one or both of those symptoms with other symptoms. It talks about things like irritability, trouble sleeping, maybe difficulty concentrating. So this could look like the typical average high school student. It might be easy to miss this. But then you might see some disturbances in family and friend relationships. And what it says here is that it can result from negative events. What I do want to say is that there are a couple of different types of depression. And some types of depression seem to be more caused by social things, difficult, stressful situations, trauma, grief. But sometimes we see depression even if there's not a specific incident. Sometimes it does seem to be biological. And so we should be aware of that. It's not always in environmental situations where you would expect depression to occur. It can happen outside of those situations as well. So it talks about 5 to 10% of adolescents experiencing depression, and it may come and go and may not be a lifelong issue for them. But then it also talks about it being more common in girls. Depression and internalizing disorders in general, so other things like anxiety, are diagnosed more in girls and in women than they are in boys or men. Now, one thing to note here is that it's possible that women truly do get depressed more, but it's also possible that we recognize it more in women. Women are more likely to be diagnosed, so that may be part of the reason for that fact. So we can't always recognize who will struggle with depression, but some risk factors to keep in mind. Emotion regulation, so some people tend to be more neurotic, and you hear the term neurotic, and it's a personality trait, and people don't always understand what it means, but it basically means not having much control over your emotions, being emotionally unstable. Also, negative self-beliefs, so people who see themselves and see the world in a very pessimistic way are at an increased risk. Having uninvolved parents or parents who are very punitive in their discipline, so that authoritarian parenting. And when we talk about punitive discipline, physical discipline comes to mind, and certainly the research is not great on physical discipline, but there are other types of discipline that can also be problematic. Sometimes parents use shame, guilt, that kind of thing as parenting skills, which I would not recommend at all. So lots of different types of discipline that are not ideal. Poverty, probably an increased stress in the home. It's more difficult for parents perhaps to be involved here if they're having to work multiple jobs or if there's a lot of tension. So certainly that's a factor, as well as biological things, so family history of depression, disturbances in serotonin or norepinephrine, which might need to be treated with medication. So it's really difficult to make decisions about treating depression with medication in teenagers. So certainly with a milder form of depression, therapy might be enough. The one thing that we see with more severe forms of depression is usually it requires both therapy and medication. The difficulty is that antidepressant medications do tend to work, but for some reason that is not well known, they increase the suicide risk in teenagers in particular. And so what we see here is that you have to make a decision about the risk. Certainly having untreated depression is risky, but then taking medication that could potentially increase thoughts about hurting yourself is also risky as well. So you want to make sure that you are supervising carefully, especially towards the beginning when the person first starts taking that medication. Therapy is also a great option to use instead of or in combination with medication. Behavioral therapy is going to focus on getting people more involved in the things that they enjoy doing or the things that make them feel good about themselves and setting up a reward system for that. Certainly, if we leave depression untreated, it can become a lifelong problem, something that can come and go throughout adulthood or even persist throughout adulthood, as well as causing problems in school. So it's very difficult to focus on your studies when you're struggling with depression, friendships, that kind of thing. So there are prevention programs. One of the best things that you can do is just recognize the signs early on and help someone get into appropriate treatment as soon as possible. One of the things that we're concerned about, as I've been mentioning with depression, would be suicide. So one thing I want to say is that not everyone who is struggling with depression is having thoughts about hurting themselves. And not everyone who attempts or dies by suicide is struggling with depression. Mood disorders are commonly associated with suicidal behavior, but also substance use, psychotic disorders, other disorders as well. Now, one thing you'll note is that suicide is very rare in younger individuals, although it could potentially happen, but we see an increase here around age 15. It talks about it being attempted by 10%, the completion rate being much lower than that, and then talking about it being rare in girls. So what I want to say here, first of all, is that girls are more likely than boys to attempt. So when it says rare in girls, they don't mean an attempt is rare necessarily. What they mean is that males, especially adolescent males, but males in general, are more likely than females in general to die by suicide. So girls or women are attempting more, but men are dying by suicide more. And the thought is that men usually use more violent means or more lethal means to die by suicide, and therefore they are more likely to die by suicide even with a lower number of attempts. Now, there are also differences in ethnicity. So Native Americans have the highest rate by far of deaths by suicide. The thought here is that, one thought, we don't know for sure exactly why, but one thought is a lack of access to diagnosis and treatment in that particular community. And then we see that after Native American individuals, then Caucasian individuals are next, and then it talks about Asian and African American individuals having the lowest rate. Part of the thought behind why this might be is that minority cultures often have a more collectivist mindset. In other words, more concerned about family relationships, maybe having more social support from like a larger family relationship, a larger family network, and so having social support and then being more concerned about how their death by suicide would impact their family might be a little bit more in individuals in minority groups. So there's a lot that I could say here, and if you have questions, feel free to email me. If you have someone that you care about that is showing signs of hurting themselves, you need to take it seriously. And you need to not be their therapist, you need to be their friend. You're not trained to be their therapist, nor should you be the therapist for someone that you know. What you need to do is to be their friend, to not leave them alone, to try to get them connected with resources, try to get them in to see a counselor, see a psychologist. Don't be afraid to ask the question, but there are right and wrong ways to ask the question. So the wrong way to ask this question is, you're not thinking about hurting yourself, are you? Or you wouldn't do anything crazy like hurting yourself, would you? That's not the way to ask that question. Just, are you having thoughts about hurting yourself? Because when you ask the question like, you're not thinking that, then you're telling them, I'm not open to having this conversation. There's only one right answer to this question that I'm asking you. So ask the question in a very open-ended, non-judgmental way. Try to be calm and supportive. And let me know if you have any other questions about that. Now, of course, we cannot always predict who will attempt or die by suicide. Certainly, there are some warning signs. It talks about depression or drug use. Alcohol in particular is associated up to maybe 70% of attempts involve alcohol. So changes in substance use can definitely be something to pay attention to. But then also someone who starts talking about hurting themselves or just seeming generally preoccupied with death. And then anything that shows potential signs for depression, so changes in eating or sleeping, which could be up or down. Could be sleeping all the time or not sleeping at all. Could be eating a lot or not eating much at all. Just a change from their normal Loss of interest, this is that anhedonia that I was talking about. Personality changes, usually we see people becoming maybe more agitated, irritable, aggressive perhaps, but then also becoming kind of sad, helpless, hopeless about the future, and then making preparations for after they die by suicide, so thinking like giving things away or changing health insurance. We don't see these signs all the time, and you can't always know when it's about to happen, but these are a few things to keep an eye out for. Now, in addition to those kind of internalizing psychological problems, externalizing psychological problems can happen as well. So here we're talking about delinquency or antisocial behavior. Now, what I will say is that antisocial personality disorder involves that having a pattern of disregarding other people's rights, hurting other people. We don't diagnose personality disorders until you're at least 18, but you might see conduct disorder in younger kids. Conduct disorder is kind of the kid version of the adult diagnosis of antisocial personality disorder, and about 50% of people who have conduct disorder as a child will go on to develop it, to develop antisocial personality disorder later in life. So certainly there is a concern. Now, if you're engaging in these behaviors only during adolescence, and it's not something that is a significant pattern, maybe it's just happened a few times, only when we're with our peers and the peer pressure thing, then that may not be a problem. But what we see is that a pattern of antisocial behavior that starts early and continues fairly consistently is something that definitely puts you at an increased risk for antisocial personality disorder later in life. Now, where does antisocial behavior come from? Well, there is certainly some evidence that it could be genetic. So it talks about identical twins being more similar than fraternal twins, thinking that twins in general are probably raised in a similar environment, but identical twins have much more in common genetically speaking. They tend to be more alike in physical aggressiveness and levels of aggression. And of course there are other types of aggression as well. It's not always physical. It could be verbal, emotional, etc. So there is some evidence to suggest that, but then also maybe there are some social things going on we're going to talk about in a second. Biological issues could be genetic. This could be how we have this genetic link. But then also it could be something that's not necessarily genetic, but you might have some issues with, for example, hormone levels, testosterone levels, which could be caused by a tumor or any number of other biological issues. Someone who is temperamentally difficult, someone who has a difficult time managing their emotions. It talks about neurotransmitter deficits, so this is something that could potentially be treated with medication, but then also cognitive skills. So someone who has a difficult time understanding other people's points of view, someone who has a difficult time understanding other people's behaviors, maybe they think someone is trying to hurt them when they're not, or someone who tends to be very impulsive, not thinking before they're acting. Certainly these are risk factors. But when it comes to social things, we know that it's important, the family functioning. Not everyone who has a pattern of antisocial behavior comes from a difficult family situation, but often they do. Certainly harsh discipline, physical discipline is associated, but poor monitoring, so kids can fall in with undesirable peers and have these patterns of behavior early because they weren't monitored well or because they're responding to marital conflict. So we've talked about some of the problems that are associated with divorce. Certainly something to keep in mind. Also, poverty may lead to an individual looking for ways to get out of poverty that may or may not be legal or may not be safe. Certainly can involve exposure to violent crime. So what we see is that you have risk factors, and no one risk factor guarantees antisocial behavior. But what can happen is they can start to build on each other. For example, if poverty causes the parents to have to work a lot, then the child may not be monitored, may not be doing their homework, might start having problems at school, might start acting out. And then because the child starts acting out, that can harm their relationship with their parent. It can harm their relationship with their peers. So as we see these risk factors pile up, certainly there is a greater possibility of antisocial behavior. So the best thing you can do is to recognize this and get an individual into treatment as soon as possible. And it would be best not just to involve the child, but also to involve adults as well. especially parents, but also potentially teachers or grandparents, other people that are involved in the child's life for sure. So what can we do? There is one program in particular that your book talks about, an example here, called Fast Track. So Fast Track is going to be a program that's going to try to help at all different stages of life. So for young kids, we're thinking you need academic and social skills that will help you to be successful. The thought is that if you can be successful early on, you'll be less likely to fall into patterns of delinquent behavior. As you get older, perhaps we have some life and vocational skills, once again, trying to set you up for success. What can you do for a career? How can you take care of yourself? How can you budget? That kind of thing. We also want to teach parents how to parent, so we have parent management training, which some parents are opposed to the idea. Some parents don't want someone else telling them how to parent, and I completely understand that. But certainly there is some research to suggest that having the parents be involved in the treatment makes it much more likely to be successful for the child. And so we can help parents figure out appropriate rules, appropriate punishments, helping them stay involved. All right, so those are the slides on adolescence. Now we're going to switch gears and talk about young adulthood, which I would think the majority of you would consider yourself in this young adulthood period. So this will be talking about you today, and then during the next lecture we'll talk about social development in young adulthood. So carrying on with what I would imagine is your time period, or for the majority of you is your time period. Let's go ahead and talk about this week's activity. So activity 8, do you feel like you're an adult? I enjoy asking this question in my in-person classes because I usually get a lot of really interesting responses. Some people are nodding their head very vigorously, like, yeah, I'm an adult. And some people are shaking their heads like, no, don't put that on me. I don't want to be an adult, which I understand. So what I want you to explain to me this week is, do you feel like you're an adult? And if so, how do you know you're an adult? And if not, how will you know when you are one? What is it that makes a person an adult? I ask you to think about this because, as you're going to see in a second, in our culture there's not really a particular defined age or milestone or ritual that makes you an adult. So it's something that's really unique to you, your personal perspective about whether or not you're an adult. So I look forward to reading those. One thing to say is that we might have an extra time period in here. We should call this early adulthood, but perhaps we could talk about emerging adulthood. Now, emerging adulthood is not a cultural universal. Emerging adulthood is a term we made up because of changes in our society. So we have not always had this emerging adulthood period. Emerging adulthood is basically saying I am older than a teenager, but not yet an adult. I have more responsibilities than I did as an adolescent, but I don't have the full adulthood. So maybe perhaps while you're in college, although you are taking care of yourself, perhaps living alone, maybe you have some help paying bills, or maybe you have some help, feeding you and washing your laundry. Certainly not everyone does. Some people are married and having kids while they're in college. So not everyone, but perhaps for many of us, emerging adulthood is this time period where you're kind of grown up, but not quite yet. Now, I say that this is not a cultural universal because other cultures might laugh at us for this. Other cultures might, you're an adult, grow up, you've got to take care of business at a much younger age. But in our culture, where people tend to be going to school and kind of dragging out the beginning of a career, we often have this emerging adulthood time period. Now, it talks about late adolescence to early 30s. Usually, you hear this as being somewhere around 18 to 25. And the person who coined the term emerging adulthood would say 18 to 25. But as we maybe stay in school longer, more likely to be getting a graduate degree, then this age period might be kind of dragging out a little bit as well. So what is it that marks the difference between adolescence and adulthood? How do you know you're an adult? Well, sometimes it is a transition in your roles or your responsibilities, and I think this is how it used to be. It used to be that getting married was a sign that you were an adult. But now people are waiting later and later to get married. Fewer people are getting married than ever have before, and more people are getting divorced than ever. So marriage doesn't necessarily seem like the right tool to use to determine whether or not you're an adult. Maybe we're thinking about having kids or starting our career or graduating from college. So I was a student and now I'm working. Or maybe you feel like some other role, something that is unique to you, these new responsibilities have made you an adult. But also, you might have a rite of passage, a ritual that makes you feel like you're an adult. And so it's not just being married, but it's going through a marriage ceremony. It's not just having a degree, but it's going through a college graduation. When I got my bachelor's degree, I did the whole walking, wearing the regalia, all of that. When I got my master's degree, it was like, just mail it to me. I'm good. I've done that one time. But for some people, it's really exciting, really interested in having that kind of ceremony. Sometimes your culture has a religious ritual that you go through at a particular age that may require some kind of studying and training beforehand. Or there may be rituals that involve pain or mutilation. Not something that we do much in our culture, but for example, in one tribe, they use bullet ants. They have their young men go out and capture bullet ants from the South America, rainforest, something like that. They collect bullet ants and then they stitch the bullet ants into these glove contraptions, and then they have to wear these gloves for hours being stung over and over again by bullet ants. And if you don't know what a bullet ant is, feel free to watch Coyote Peterson. My kids love Brave Wilderness, Coyote Peterson, but you can Google. But bullet ants, pretty intense. They call them bullet ants because supposedly it feels like you're being shot when you are stung by one. And so it would involve then this terrible pain of having your hand stung over and over again. And certainly there's a lot of risk associated with that. Now, to us, that seems very strange, but in that culture, that would be something that would be very important to them as a sign of transitioning into an adult. Glad that we don't do that, because I'm not sure I could ever be an adult then. All right, going to college is something that might be considered something that's a transition into adulthood, or at least into emerging adulthood. College attendance is certainly pretty high today. The vast majority of people are at least going to college for some period of time. Whether or not they finish college may be another matter, but they're definitely going for some amount of time, as much as 67% of people, and that number may be on the rise. It talks about increasing diversity in people who are in college. One thing in particular, age. Oftentimes we think of college as being individuals from 18 to 22, but you might have some non-traditional students who are coming back to school later in life. Certainly, as I've been teaching for, about 6-ish years now, I've certainly seen lots of older students coming back and getting different degrees or finishing degrees they had started earlier. So college success is something that can be really good for an individual. It can definitely increase well-being, as well as helping them find a career that they enjoy and that is financially stable for them. One of the best things that you can do to be successful in college is to take personal responsibility. I talk about this at the beginning of the semester, but there's a lot of research to show that when you view your grade as your responsibility, and that's something that's personally important to you, then you are much more likely to be successful. Alright, what about relationships? Maybe you feel like you're an adult when you're in a romantic relationship, when you're living with someone, when you're married, whatever the case may be. Well, Erickson would say that the stage of life during this early adulthood, emerging adulthood time period would be intimacy versus isolation. Intimacy doesn't necessarily have to come in the form of a romantic relationship. Intimacy is really talking about a psychological connection with another person. Maybe you could say a shared identity. And this could be with a romantic relationship, but could also be with a best friend or family members. So one thing that we're thinking about during this time period is trying to understand who you are. So there are a couple of different arguments here. There's an argument to be made that you need to understand who you are before you can have healthy relationships. And this is the argument to wait until you're older to get married, figure out who you are and what you want out of life before you can love another person. But then there's also an argument to be made that you don't have to necessarily understand yourself to care about another person, and that being in a romantic relationship may shape who you are. the idea that getting married younger and then kind of shaping each other as you start to become who you are could be a beautiful thing. Of course, we're going to talk later about divorce rates, and divorces may be a little bit more common in people who get married at a younger age, but that's probably because of stress, financial issues, etc. But there certainly is something beautiful about truly growing up with this other person. All right, maybe you say, I'm an adult when I pay all of my own bills, which really makes adulthood sound fun, I know. Major marker of becoming an adult, financial independence. And of course, for most of us, this is going to come through a job. And so this could be like full-time job, maybe even potentially a part-time job, or military as well. Now, one thing to note is that it's very difficult to juggle a full-time career and college, although I certainly understand how that can happen. It is very difficult to do because college in and of itself is a full-time job, essentially. At least it should be approached as such. It should be taken seriously as a full-time job. So what we may see is that someone may go through college focusing on school and then graduate and be ready to start their career, but they may have racked up a lot of debt. And we could spend all day talking about student loans and all of that and financial aid, but the point is college students are often in a bad place financially when they finish school. And so we do see a trend of college graduates living with their parents for a while as they try to get back on their feet financially after all the student loans and things and trying to start their careers. So on the one hand, you might feel like, I'm an adult now, I graduated college, but then on the other hand, you're back living with your mom, having her do your laundry, which, if my mom wants to come and do my laundry, that's perfectly fine. All right, so when do we become adults? Well, you've heard of a midlife crisis, but what about a quarter life crisis? Of course, this is essentially saying we're going to live for about 100 years, and that may or may not be true, but a quarter life crisis when you're about 25 years old, similar to a midlife crisis, the idea is you're trying to understand who you are. What do I want? Am I going to get married? Am I going to have kids? What kind of career do I want? Where do I want to live? What am I going to do with myself? And that can be really overwhelming. And certainly I have, I encourage students to get counseling, to have somebody to talk to. But especially during this time period when you're trying to make a lot of really important decisions and you're feeling very stressed out, it's very natural for you to need somebody to talk to. So my answer for everything is therapy. But by all means, if you feel like you're entering this life crisis, find somebody to talk to. Okay. All right. As far as physical development is going, I hate to say it, but it's all downhill after this. So during young adulthood, height is at its tallest. You actually shrink a little bit as you get older. Physical strength, coordination, dexterity tends to peak in young adulthood and then go downhill, for some more gradually than others, so depending on a lot of factors, genetic factors, how well you're taking care of yourself, how much stress you're experiencing, that kind of thing. Most of our senses stay relatively acute through at least middle age, if not older age. But one thing to note is that hearing can start to decline as early as the late 20s. So you want to make sure that you're taking good care of your hearing and you're not exposing yourself to very loud music, going to concerts and standing very close to the stage, and that kind of thing might be fun in the moment, but not great for our hearing, and something you might regret a little bit later in life. As far as health is concerned, usually we think of young adulthood as being a time period where health is relatively good. 94% of young American adults say that their health is good or even excellent. So usually the people who have, who are not saying this are ones who have chronic health issues, that kind of thing, maybe that started in adolescence or childhood. We do see the leading cause of death being accidents. So the majority of individuals who pass away are going to be passing away from accidents, but then also usually in the statistics here, suicide is up there as the second or third leading cause of death as well. Thinking about accidents, we see that accidents tend to happen more in boys than in girls, more in men than in women, and then there are also some ethnic differences as well. But as I'm thinking about accidents being more common in men than in women, there are several different potential reasons why this might be, but a couple that come to mind. Men are more likely to be diagnosed with ADHD than women, and people who are diagnosed with ADHD are more likely to be involved in accidents. So that could be one thing to potentially be thinking about here. Also, men are more likely to use substances than women. And we know that substance use can be associated with accidents. So we do see that death in an accident is more common in men than in women. Other things to be thinking about: nicotine use. Talks about smoking here, but there are other ways, smokeless tobacco, dipping, that kind of thing, other ways to use tobacco. Now, we know that nicotine is dangerous, and usually the thing that you think about is cancer, and it does definitely increase your risk of cancer, but it's also a stimulant that can increase pulse and blood pressure and can cause heart-related issues as well. So there are lots of different things that can be harmful from using tobacco. So it is best to quit, regardless of when you quit. Some people might think, well, I've been smoking for 20 years, so there's nothing I can do now. Not so. You can definitely benefit your health even if you're quitting later in life, but the sooner you quit, the better. Of course, I do understand, at least partially, how hard this is. Never having used tobacco myself, but my husband did, so I know what that's like and how it is to love someone who's going through the withdrawals. And so that's something that can definitely be difficult, challenging, but in the long run, certainly worth it. Besides, you add up how much money you spend on tobacco, and that's potentially motivating as well. What about alcohol? You've been waiting your whole life to be old enough to drink alcohol, right? Well, because we're waiting until we're 21, right? So, how much alcohol is too much alcohol? Drinking alcohol on occasion is not usually a problem. Of course, there are differences in what we consider appropriate and inappropriate alcohol use. Heavy binge drinking, which binge drinking is going to be defined differently for men and women. Without going into any great detail here, women are not able to break down alcohol. Their bodies don't have as much of the enzyme that breaks down alcohol, and so they have more of an effect from alcohol. So women are not going to have to drink as much alcohol, on average. Women are not going to have to drink as much alcohol to become intoxicated as men will. But binge drinking is definitely dangerous. It talks about it promoting victimization. Certainly there is never an excuse to say, well, it was okay because the person was intoxicated. Definitely not. Having said that, you are at an increased risk, so please be careful. If you are going to be using substances, please be very careful the settings in which you do. But when we're talking about binge drinking, we're talking about doing about 5, it could be more, or 4 or more drinks in a row in a short time period, and doing this repetitively, having a pattern of this. And binge drinking is something that is very common. I've seen some numbers up to 50% of college students have had a binge drinking episode in the last couple of weeks, and at any given time. And so certainly binge drinking is something that needs to be talked about on college campuses. I think that part of this is because of the culture. We expect this is what we're supposed to be doing as college students, but I also think that stress is an issue here. So certainly heavy alcohol use can lead to an addiction. There are lots of different symptoms, but basically when you're trying to figure out if you are addicted to a substance, we're talking about tolerance and withdrawal. Tolerance happens when you need more and more of a substance to feel the same effects. Withdrawal happens when you have most painful symptoms when you stop using a substance, and usually the withdrawal symptoms are opposite of the effect of the drug. So if the drug makes you feel relaxed, then you feel really restless during withdrawal. Or if the drug gives you energy, then you feel really tired during withdrawal. So we know that there are a lot of symptoms that then make it difficult to quit drinking. Because if you drink alcohol and it gives you a good feeling, that's positive reinforcement. It adds something good. But there's also negative reinforcement because it takes away something bad. So it maybe takes away the anxiety. It takes away the stress. So certainly you get rewarded for using the substance, and then that painful withdrawal will punish you when you stop using the substance. So it's definitely difficult to treat, but we do have treatments that can be really effective, but the person really has to be motivated. Now, as far as nutrition goes, one thing you'll notice as you get older is that your metabolism will slow down, and therefore you'll need to pay more attention to what you're eating. So you'll want to think about limiting the things that maybe you ate more of when you were an adolescent. Thinking about keeping an eye on saturated trans fats, sugars, salts, etc. We know that obesity is a problem because it's linked to a lot of health-related issues. And in our culture, obesity is on the rise, so definitely something to keep an eye on. Your weight is at least partly genetic, but then also there's a lot of environmental things, a lot of things you can do to try to reduce that, making sure that you're exercising, that kind of thing. One measure for your weight-related health would be the body mass index. Now, I know that the body mass index is not perfect, that it just basically has a formula based on your weight and height. So some people might have more weight because they have more muscle, that kind of thing. So it might not always be 100% accurate, but as your BMI gets very high or very low, there are certainly health risks associated with that. Other things to be thinking about when we're talking about health in young adults, if you are in poverty, which many college students are, then this can definitely impact your health. Maybe not having adequate nutrition, maybe not having health insurance or not being able to get access to health care, which can then end up causing problems. But however, getting through college, surviving college, and then going on to have a career is good for you as far as your health is concerned, because then you're more likely to have access to health care, have income, health insurance, that kind of thing later in life. So it's kind of a swap off where you go through stressful periods now to try to save yourself some stress later. One thing that we see is that women tend to live longer, and we'll talk some reasons about why this might be when we get into older adulthood later, but women tend to live longer, less likely to die from homicides as well as accidents, as we said earlier. All right. Now, if we're talking about cognitive development in young adults, not a lot different from our previous discussions of cognitive development. One thing to be thinking about is, as you get older, are you becoming more or less intelligent? So there's a theory that there may be some aspects of your intelligence that are getting better as you get older and some that are getting worse. And we'll talk about an example of this in a second. There's also a theory that a lot of it depends on what you're doing. It's not just a pattern universally for everyone. Some people do things to try to keep themselves sharp. You know, you're doing your Sudoku and your crossword and other things. And so it might be more about the environment you're in, and if you don't use it, you lose it, that kind of thing. Plasticity refers to the ability to modify something. So we typically think of the brain as being very plastic, or having high plasticity in young kids. So if a young child has some kind of accident, injury, surgery, etc., their brains can usually bounce back. Even one part of the brain taking on a function it doesn't usually perform because another part of the brain is damaged. Incredible plasticity. But then as you get older, that plasticity decreases so that a brain trauma later in life is harder to recover from, although there is some research to suggest that it can still at least partially recover in adulthood. So one theory here about your intelligence changing as you get older is that your fluid intelligence may be decreasing as your crystallized intelligence increases. So fluid intelligence is usually what's measured on an intelligence test. It's kind of your overall potential to think quickly, to solve problems, as far as being able to make inferences and being able to understand concepts. So being able to remember information and use that information quickly can decrease as you get older, but crystallized intelligence, you get wiser. You accumulate information, facts, real-world experience. So someone who is older may not be thinking as quickly as someone who's younger, but they might have some experience to draw from. So certainly there are there's some evidence to say we should be looking up to older individuals. The wise stereotype may be true, but once again, I think that depends on life experiences. Some people might have had more exposure to these facts and the knowledge they may have accumulated more of. Alright, last couple things to be thinking about for this lecture video. When you think about your life during young adulthood, you're trying to understand what has led me to this point. Where am I right now, and where am I going? And where do I want to go, and where do I not want to go? And so oftentimes during young adulthood or emerging adulthood, we're working through these scenarios. We think about, okay, I want to be married by this age. I want to have kids by this age. Or I don't want to have kids perhaps. Or I want to have this kind of career. I want to be at this level. I want to have this promotion. So we have a game plan. And perhaps we have this social clock, which may come from ourselves or from other people, thinking of this is when this is supposed to happen. So I had a student tell me once, I asked the question, is there a right age to get married? And the student said she wanted to be married by age 25 or not at all. And I thought, wow, that's a lot of pressure. But that was a very specific social clock. So maybe we feel like we have some idea of how our life is going to play out. Of course, certainly there's no way for us to know for sure. And maybe perhaps we look back on what we used to want and we don't want that anymore. But when we're thinking about the future, we think about possible selves, which could be something we want to be or something we don't want to be. Now, this may depend on your experiences. Some people say, I want to be just like my mom. And some people say, I don't want to be like my mom at all, or some complicated combination of the two. So you have something that you want for yourself and something that you want to avoid. Now, as people get older, in our culture, in our individualistic culture, where we tend to think more about ourselves, as you get older, you might find personal matters feel more important to you than family matters. So maybe you say, it's more important for me to feel like I'm in a good place with my career, or it's more important for me to feel like I'm in a good place financially. Certainly in a more collectivist culture, and for some individuals, even in an individualistic culture, you'll be more concerned about what your family life looks like. So as you get older, you may become more and more concerned about these feared selves, especially physical health. And we're going to talk more about this when we talk about older adulthood, but certainly people have fears of losing their abilities, especially maybe perhaps some psychological issues or mental issues, concerned about dementia, a decline in physical health in general. So you have things that you want to be and things you want to avoid being. And then the question is, do you think you have control over these things? So some people feel like everything that happens is outside of their control. And some people feel like they have control over things even though they may not have control over them. So think about this. If you feel like you have control, then maybe you'll work harder. Maybe you will feel more personally invested in the work that you're doing because you feel like you have control. On the other hand, it talks about these inconsistent results here. On the other hand, if you feel like you have to be in control, isn't that stressful? And wouldn't that then make you more likely to fail because you put too much pressure on yourself? So there's a balance here where there are some things where it feels like we have control over and some things that we don't. For example, what about your intelligence? You're born with a certain level of intelligence, and certainly the life experiences you have can increase or decrease that a little. But then what about your health? You're born with genetic predispositions, and then perhaps there are things you can do to improve your health or things you can do to harm yourself, but you might be born with a genetic predisposition you can do nothing about. So a lot of this is your personal belief about your health or about what's going on with you. So one thing that we see is that people have this perceived control over marital happiness. Some people feel like I can make my marriage be successful. It's up to me and my partner. And then some people say, well, the destiny beliefs. If I'm with the right person, it'll work out well. And if I'm with the wrong person, it won't. And so that's, once again, correlated with divorce. But as people get older, they might feel like they have more control over keeping their marriages happy. Or they might feel like they don't have control over their general development. Maybe you feel like you stop developing. This is something that I think with human growth and development, it's really important to have a lifespan view here because you do continue to develop even as you get older. It's not like you stop developing when you get through with college, right? One thing that we see is that younger adults are usually happier if they think that their success is due to their effort, maybe because this keeps them motivated to put in more effort. Older adults are usually happier if they think their success comes from their ability, maybe because they're getting too tired to put in the effort. But hey, I've got the natural ability, so I don't have to put in as much effort. Younger individuals may feel like they haven't fully developed their abilities, but I can work hard, I can earn it, and so your viewpoint may be more important than reality when it comes to these issues. Alright, so lots of information for today. Let me know if you have any questions or concerns. Don't forget that you do have an activity. Let me know if you have any questions, and I will talk to you guys during the next lecture video. Have a great day.